Welcome to Hope in the Face of Cancer, where we share real stories of courageous people in their cancer journey. Today's episode features an extraordinary guest, Dr. Joni Watson, a true pioneer in oncology care who has dedicated her life to serving others with heart and vision. With over 20 years of experience as an oncology nurse leader, Joni's journey has had a remarkable impact on our cancer community. She's not only led the charge in cancer care by creating a cancer center in Waco, she also leads a healthcare consulting business, teaches future nurses at Duke University, has authored journals and books, and leads healthcare discussions and stories of resilience as the host of her two podcasts. Joni's heart for people is at the center of everything she does, from her role as Chief Vision Officer of the Creating Collective to her position as editor of the Clinical Journal of Oncology Nursing. Her mission is to transform cancer care and make it more patient-centered and compassionate. Join us as we learn from Joni's wisdom, experience, and unwavering dedication to making a difference in the lives of others. Joni, thank you so much for joining our show today.
Oh my goodness. Thanks so much for having me. I'm thrilled to be a part and to just engage in conversation today about hope in the face of cancer.
Hey, that's wonderful. I know our audience will really enjoy this today. And I just wanted to start out by saying thank you. I mean, dedicating your career to our cancer community is just truly incredible. And so thank you for what you've done.
Oh, my pleasure. I wouldn't have it any other way. It's been a highlight of my life.
Well, absolutely. Well, let's tell our audience a little bit about how all this started. I mean, how did you really find yourself in the oncology space?
Yeah, absolutely. I would say short answer, God's divine hand, honestly. Longer answer, I have always been pulled towards helping people through healthcare. And for
Hmm.
me, I originally thought that was to be a physician
Yeah.
in the healthcare space. And so my life early on, my husband was in vocational ministry, and as I was thinking about, oh, he might get called to, help a church, we might need to move. Maybe I need to think through some healthcare roles that might be a little bit more easier to just kind of pick up and
Yeah.
move when needed. And so I decided, still with an intention to be a physician and kind of figure out med school and residency and things like that, but go to nursing school first. I
Hmm.
thought it, would help bolster our lives and our finances and be a practical healthcare choice, and then help me down the road as a physician as well. And I got into nursing school and I realized that, oh my goodness, it's nursing that I love in healthcare. I
Mm.
really fell in love with the nurse patient relationship and the way that nurses influenced healthcare, both in acute spaces and longitudinally over time, and just the various ways that nurses can serve in different roles, not only in traditional spaces per se, but also in tech companies and
Yeah.
government relations and all of those things. And so decided, okay, I'm going to go forward with nursing. But then I thought I was going to be a labor and delivery nurse. And again, I firmly believe God's divine plan and hand kind of rerouted me into the oncology space very early on, as within the first year of becoming a nurse. And I never looked back. I fell in love with the specialty. I fell in love with the patients that were entrusting some of
Yeah.
the most vulnerable moments of their lives with us. And so it's been an incredible profession. I love my specialty. I also tell people I feel like I have a specialty in nursing leadership as well,
Yeah.
but oncology is my first love, without a doubt. It's an incredible specialty in nursing.
Well, we're so grateful for that. Along your journey, you also have been touched by cancer personally. Tell us a little bit about that.
Yeah. So, the unique thing about cancer is that it is no respecter of
Yes.
persons. And so, everyone has someone near and dear to them who has been impacted by cancer. And Early in my life, I was fortunate to have the majority of my grandparents and even my great grandparents around me. And
Mhm.
the first real illness journey that I saw was my great grandfather through leukemia, his leukemia journey. Um, but other than that, my biological family had largely been untouched by cancer. I definitely have had aunts and uncles through marriage or, those sorts of
Sure.
things impacted by cancer and built programs and services all along my career thinking about what would I want
Mm.
for myself or my family. And I am so glad that I built programs and services like that because
Yeah.
my immediate family absolutely has had to have oncology services that I built. Wasn't
Wow.
the plan, but both of my parents are cancer survivors. My dad, a prostate cancer, my mom, CML. I'm one of four children, so I have three siblings. My two oldest sisters are both breast cancer survivors, both diagnosed at the age of 50. They're both doing quite well.
Oh, wonderful.
One is on her endocrine therapy journey. The other sister just finished her last cycle of chemotherapy and is
Oh,
preparing
that's wonderful.
for surgery. And so I have definitely had some intimate experiences with cancer, not just with people who trust me, who come into our room as complete strangers and we leave the room with a sacred relationship
Yeah.
as a healthcare provider and professional and someone who's on their journey, but also through my personal family as well. And so I'm really thankful that I had mentors and leaders in my life encourage me to think about the patient from a
Yeah.
different perspective because it has changed the way that I have provided care over the course of my career for the better, I think, honestly, to think about what would I want for my own family if they were in this room with me.
Absolutely. And who would have thought when you started that journey that the work that you were doing and what you were building would impact your immediate family?
Absolutely, absolutely. It's a little astounding because
Yeah.
my dad is one of 12 siblings, so I have lots of family
Wow.
members. And really it has been our, immediate family that had the majority of the cancer history in his family. And so I certainly would have never expected this. But I mentioned, God's divine hand over the course of my career. And I firmly believe that God saw far in advance. And, as I was right there with my mom or my dad or both of my sisters, I was able to say, hey, this kind of came out of nowhere for all of us. It didn't come out of nowhere for our Savior. And so he's put provisions in place. And hey, here's one of your provisions. I'm right here with you, gonna walk this with you. So I'm really thankful to be able to
What a
help my
beautiful,
family.
yes, what a beautiful testimony that is. So, as you think through your 20 plus year career, you've undoubtedly experienced so many different patient interactions, family interactions. You've touched so many lives. It is often overwhelming for someone facing cancer to navigate the healthcare system. What advice would you have for someone newly diagnosed about navigating today's healthcare environment?
I would say that first, I'm sorry that you're experiencing this. And the second thing that I would say is that you're not alone.
Mhm.
And that statement comes with some assumptions and biases interwoven through that. And so, even for those who feel like they may be alone, maybe they don't have strong social support, maybe they don't have strong family support. Um, I want to encourage you that as you navigate the healthcare system, which is complex and frightening, and it hurts me to say this, it's the reality. Healthcare is broken in a lot of ways, that you are not alone. There are many professionals and paraprofessionals all around you with one focus, you. And so if you need support, if you feel like you might need support, you often are a great advocate for yourself.
Yeah.
And so lean into questions, lean into conversations, even if they're uncomfortable at times, because I can speak from a nursing perspective. Nurses have hard conversations all the time. And what you might be shying away from is probably an everyday kind of conversation for a
Right.
nurse or another healthcare provider. And so just know that you're not alone and that your voice is powerful to
Mm.
affect change. And so if you do come across processes that are broken or clunky, or you think, goodness, it really could be easier if XYZ was built into this process or program, I would encourage you to share that.
Yeah. Speak up.
Yes, most of my career, while I have certainly been at an arm's length, at the person that touches another person in care, a lot of my career has been in leadership, where I get the opportunity to take care of the people who take care of the people. But leaders are just as much a part of the healthcare team as the direct care nurse or the physician or the social worker. And so, if you have an opportunity for a process or program improvement, I would love for you to think, you know what, is there a leader here I could talk
Mhm.
to maybe share this with? Because leaders are there to serve patients in completely different ways, often through building or improving new or existing services. So you're not alone. There are people who are there focused on you. Speak up, advocate for yourself, and know that you're not alone in this.
Thank you for that. As we think about cancer treatment and the cancer journey, the emotional support component often is not thought about or relegated. Oftentimes, I think cancer patients and family members too don't think about the emotional support needs that they may have. So, from your perspective as a nursing leader and just a healthcare leader in general, how important is that emotional support component of the cancer journey? And what advice do you have around caring for that piece of your wellness?
Yeah. So when we talk about emotional care and emotional wellness, it's hard to parse that apart. And that's largely because of the way that nurses are trained. Nurses are trained in what's called a biopsychosocial healthcare model, where we have the physical pieces of healthcare, we have emotional and mental pieces of healthcare, and then we have the social needs of healthcare. And all of these pieces together make up a whole person.
Mhm.
And so sometimes the reason that emotional needs kind of fall by the wayside, whether we intend for it to happen or not, is because we can get so focused on the physical aspects
Yeah, the
or
treatment plan and
yes, absolutely. And goodness knows there's a lot to
yeah,
that, right? You've got all of these medications or appointments. There's a very specific order that things have to happen. You're consuming large amounts of information just to take care of the physical part of yourself. But we can't parse apart the emotional aspect. And I think nurses are great at this, so are social workers as well. I could use a lot of different examples. One example being, let's take a practical need like affording a medication. Okay, it's a
hmm
very practical piece. If we're not able to afford a medication that we need, we end up not only with physical issues, perhaps, that we need to manage with that medication, but we also have this undercurrent of emotion, anxiety, this tension of fear, maybe even some grief and shame. All of those pieces together from a practical need impact an emotional aspect of care, which then can become a very large physical aspect of care. When we are anxious and tense, we have increased blood pressure, our pulse rate goes up, our respiratory rate goes up. We might have headaches or muscle pain, in addition to all of the other signs and symptoms that we're trying to manage through our regular treatment plan. Um, I want to give a little bit of airtime and shine a light on a topic that doesn't get a lot of airtime,
Yeah.
but is intricately tied to this biopsychosocial model, particularly around emotion, and that's sexuality.
Hmm.
Um, Sexuality, you can't really piece apart the physical and the
Right.
emotional aspects of sexuality and who we are as sexual beings. And so many times, we don't talk about those things, but we
Yeah.
have national guidelines in which healthcare providers are advised to talk early and often about
Mm.
sexual health needs. And that includes the physical aspects. And there are indeed unique physical aspects to sexuality, especially going through all different sorts of treatment plans, um, whether we're talking about hormone therapies or not. But then there's this emotional piece of
Yeah.
our sexuality, and sex is just as much in our heads as it is in our bodies. And so, to me, that's a great example that we get the opportunity as healthcare providers to lean into a space that is highly interconnected and intertwined. And this is one of those topics where I want to give permission to
Mm.
people to talk to their healthcare provider
Yeah.
about whether that's your physician or your nurse. Maybe it's a physical therapist or a social worker. If your organization is large enough to have sex therapists, you know, whoever it is, we're all trained to have these conversations. And so you might be worried about something that we can talk about without any uh, ancillary feelings attached to it. We can focus in on you and your emotional health. But I want to encourage you again to raise your voice. Ideally, your clinician is bringing these things up, right? Even if they're sensitive issues like
Yeah.
sexuality. But even if not, whatever your emotional state, I want to encourage you that your healthcare provider is there to see you as a whole person, not as a siloed treatment plan, not as a singular, MRN medical record number in the electronic health record. You're a whole person. And that creates some complexity, absolutely. But we're here for it as nurses and other clinicians. And so, yeah, it's hard to parse apart all of
Yeah.
those pieces, physical, emotional, social, because we're holistic beings and
Yeah.
whole people in care.
Well, and to your point, your emotions and your emotional state and during the cancer journey can absolutely impact your physical health and your health outcomes. And,
Absolutely.
I don't think there's a whole lot of awareness around just that importance of caring for your emotional needs during the cancer journey, which is, why we exist at CanCare. So it's wonderful to hear you make that correlation. You talked about the whole person.
Mhm.
And I think, when looking at what you did in Waco with this community cancer program, to me, I really looked at it as the intention as being about serving the whole person. Share that story of what inspired it and that journey to create that center.
Yeah, absolutely. So, a part of my career, I was invited to join a team at Baylor Scott and White to build a comprehensive community cancer center in Waco, Texas, which for national listeners, Waco is about equidistance between Dallas and Austin on the Interstate 35 corridor. And really, cancer care was quite fragmented at the time. People in the community were having to drive hours to get integrated health care, having to leave the community that they love, sometimes stay overnight, creating additional practical
Yeah.
issues
And
and
stress.
barriers.
Hmm.
Yes, which again just kind of
Hmm.
dovetails into all of those emotional pieces as well. And so during that part of my career, I thought, when would I get the opportunity to build a comprehensive community cancer center? And, I'm a Texas native, born and raised. I grew up in a small town, Corsicana. And so Waco is about an hour from Corsicana. It was the bigger city for us growing up. And so I still had a lot of family members who lived around that area. Brought me closer to my parents, closer to my in-laws, and so I jumped in with a great group of leaders, and we built this beautiful building called the Baylor Scott and White McClinton Cancer Center now, and brought all of the oncology services under one roof, which was new to that community. So, medical oncology, radiation oncology. We built supportive oncology, which included nutrition services and social work and financial navigation as well. We built plastic and reconstructive surgery services. We really took the community needs assessment that our hospital was required to do for tax purposes, quite honestly, and really tried to identify, okay, what do we need to build for our community to take care of our community? These aren't nameless, faceless people. These are our neighbors, our teachers, our first responders, our civil servants, elected officials. The farmer that we know who our
Yes.
cousin hunts on their land for dove season. These are people that we
Yeah.
know and love, and so we really had the opportunity to think through from all different disciplines, nurses, physicians, social workers, radiation therapists, pharmacists, just a beautiful team of thinking through what do our friends and family members face throughout their cancer treatment? What do we need to build or implement to take care of them that makes sense that we can do in community care so that they're not having to leave
Yeah.
this community and they can continue doing the things that mean the most to them, whether that means working at this time or being with family members or going to the ball field with a grandkid or something. So we really thought through that. And again, I'm so glad that we did think through that and ask ourselves, what would we want our family
Yeah.
members to have? What would we want for ourselves if we were getting care here? Because I've had numerous family members receive care. And to me, just knowing at that point of diagnosis, or even if they're not diagnosed, if they're going to get their annual mammogram, for example, for me to be able to say, oh, so and so is going to take care of you today. She is absolutely phenomenal. And the reading radiologist is incredible. You're going to have your results before you walk out of the door today because, we had already worked on those
Yeah.
processes so that you don't have to worry about, is my mammogram, is there a finding? Am I going to have to come back and pay another fee? So it remains one of the highlights of my career to do great work with great people to care for our community. I love community care. Don't get me wrong, I love academic medicine too, large organizations that are doing cancer care and pushing cancer care forward in a lot of novel ways. About 80% of cancer care happens in the community.
That's right.
And so we need to make sure that our community cancer care is top notch because these are the people that we love.
Absolutely. And I love how you put the patient in the center and you really built everything around that patient. And it's our
Yes.
same philosophy at CanCare. The client is at the center. What do we do? How do we support them? Everything's driven to them. I think
Yes.
so many could learn from what you all did in Waco.
Oh, thank you. Thank you. It definitely takes a different perspective, and it's easy to lose sight of if you don't have multiple people on the team who are always pointing back to the mission and the vision and
Right.
the values, right? I
The
mean,
why are we
especially
here? Yeah.
yes, absolutely, absolutely. A large part of my focus as a healthcare leader is finances. And, usually what I tell other team members is, hey, if we can just keep the patient at the center of this conversation, usually the bottom line takes care of itself. We
Yeah.
can shake the rest of these things out. But let's think through this as if it was your mom that we're talking about right now.
Absolutely.
That changes things.
Absolutely. So that patient centeredness has been an undercurrent of your career, but so has kind of advances, in treatment and technology and even artificial intelligence. So
Yes.
tell us a little bit about what advances you've seen or are seeing that you're most excited about the future of oncology care.
Oh my goodness. Cancer care has always been on the front line of propelling healthcare innovation forward. It really has, and today is no different. It's hard for me to believe that I've been a nurse for 21 years. It's hard to believe that. Um, I have seen so much transformation in oncology just over 2 decades. It's
Mm,
astounding to
yeah.
see. So, most of if I was to even subspecialize
Hmm.
within cancer care, I really focus on cancer prevention and early detection. And so, if we think about even that space over the last 20 years, my goodness, we have seen the advent of cancer screening guidelines shifting quite a bit over
Hmm.
those 2 decades. They're getting younger and younger
Yes.
because we've seen the benefit of a lot of studies of being able to screen patients at certain ages. We've seen in the last 2 decades the rise of the HPV vaccine,
Hmm.
human papillomavirus, which, I can nerd out for quite a bit on the HPV vaccine. HPV is linked to upwards of 17 different cancers.
Wow.
And we have a vaccine that can help reduce the risk of that. It is HPV positive cancer is the primary driver of cervical cancer, not just in Texas, but across the world.
Hmm.
We have a vaccine that can practically eliminate the risk for cervical cancer through
It's
HPV
incredible.
positive. It is astounding. When we think about cancer imaging and detection, you mentioned AI and machine learning. This is a space where we have a lot of different AI and machine learning applications kind of rising and within
Yeah.
healthcare. But this is one of the spaces where that technology really started, not to identify things in a silo, but for that platform or technology to team with a real clinician and enhance the expertise of that clinician. So a lot of people don't realize if you're having a cancer screening like a mammogram or a colonoscopy, even some certain pap smears and low dose CT lung cancer screening. That's another great example. That just happened in the last 20 years, those guidelines coming out. But if you're having some sort of oncology screening, imaging, there is a high probability that AI is already a part of that technology. Again, not in a silo, but working with a clinician to enhance the clarity of that image, to take a closer look. So that's just cancer prevention and early detection. My goodness, if we kind of go through the types of cancer treatments, surgery has seen the rise of minimally invasive surgery. So when we think about robotic surgeries, I mean, prostate cancer surgery has become much more focused and intricate. And because of that, we get the opportunity to minimize or reduce the side effects
Yeah.
associated with those really big surgeries. We have things like interventional oncology now, where we can actually use microwaves or radio frequency waves to ablate or can insert chemotherapy into veins inside organs to deliver microscopic doses of chemotherapy to very targeted places. Medical oncology, oh my goodness, this is the space where our drug pipeline has just exploded. My goodness, we've got genetic and genomic information that
Yeah.
really helps us see how do we individualize and specify this treatment plan for this person based on their genetic drivers and their DNA. It's individualized so specifically that oftentimes when someone in my network comes to me and says, "Hey, I have this kind of cancer, but I had a friend that got this kind of treatment," I will usually say, well, if you've seen one treatment, you've probably seen one treatment. Yes, there are some
Right.
things we do the same, but we're going to take a look at your DNA to figure out what kinds of drugs will fit that tumor target so that we can eliminate it totally. In medical oncology, we now have the growth of CAR T cell therapy, where we can take natural killer T cells from a person and we can clone healthy T cells and put them back in a person so that it targets only that direct tumor. I mean,
Mind blowing. Yeah.
mind blowing. We have another therapy that's growing. It's really only approved now for one indication, melanoma, but you'll start to hear a lot about TIL therapy, TIL. It's tumor infiltrating lymphocyte therapy. And that's where, again, we can take a look at the structure of the tumor, take a look at your blood, and we can basically genetically modify your blood and give you a product and then support your immune system to target just that tumor. Radiation oncology, equally as advancing over the last 20 years. I mean, we've seen changes in proton therapy, high dose radiation therapy, 4D radiation therapy, where we can radiation therapists and physicists and dosimetrists can work with the clinician, map the tumor, I mean, down to incredibly precise measurements, and then align you to the treatment machine so that the treatment machine follows your breathing and moves the radiation in concordance with your body movements and your
Oh,
breathing.
wow.
I mean, it is just incredible the things that I've seen in 20 years. And as I, try and stay on the forefront of what's happening, it's mind-boggling, and it's stretching to try and stay on the forefront because there's just so much happening in this space. Again, all with one focus: to take care of people and to help improve their lives ongoing. So, oncology is a beautifully forward-facing and innovative specialty. Lots of changes.
Well, your excitement about it is contagious and it gets me excited. Is there one particular, if you had to pick one innovation on the horizon that we may not, as lay people, be aware of? What are you most excited about?
Oh my goodness. Well, it's really hard to pick just one thing because all of those things work
Yeah.
together. You know, um, I think just the continued growth in genetic precision,
Mm,
honestly.
yeah. Personalized medicine.
Yes. Oh my goodness. I mean, again, the things that we're doing now with CAR T therapy, which is mostly for our hematologic malignancies, but now the work that's happening with TIL therapy, which is focused on solid tumors. To me, that's pretty incredible. And so, yeah, personalized medicine for me, because, we even have aspects of that in cancer prevention, in
Sure.
surgical oncology, radiation oncology. So, yeah, that's the thing that excites me the most, I think.
Well, you've got us excited too. Um, your passion is so evident, and that's so contagious. On the flip side of that excitement, I know there's been challenging times.
Yeah.
Tell us about, a particularly challenging time in your career and how you've overcome that.
Oh my goodness. Which one? Which one
Pick
shall we pick?
one. How do you pick one too?
You know, it's hard for me to not think about the COVID-19 pandemic,
Mm, yeah,
because, man, it's really changed the way that we did a lot of healthcare. It impacted clinicians in a lot of ways. I'm still not sure the general population fully understands, because we were trying to move so quickly,
yeah,
sometimes made wrong decisions,
sure.
which, um, I can tell you, I've never met a healthcare provider who wakes up and wants to cause harm that
Yeah,
day. We kind of hold those spaces, carefully and with very sacred hands and hearts. So the COVID-19 pandemic was quite challenging for me as a nurse. It's challenging from an oncology perspective as well. We're just now starting to see some of the impacts that the COVID-19 pandemic had, particularly around cancer prevention and early
right,
detection when we closed all of
right.
those spaces, right?
People weren't
So
going
not
in
only,
for preventative care and
yes,
mhm,
absolutely, absolutely. So not only do we have that sort of, what I would call on the front end of our care continuum, but also on the back end of our care continuum, where we have all of our cancer survivors who we know need different kinds of cancer screenings
mm,
to remain healthy and
yeah,
continue all of those years that we've all worked so diligently to give them. Um, so now we're starting to see some disparities, places where we had taken, a couple of steps forward. Um, Now we're realizing, hey, we took a couple steps back. And so we're going to have to work additionally hard to increase some of our screening rates. Um, it changed some levels of trust for some people across the United States. And, we also had during that time an increased rise in, just sort of a racial reckoning in the United States
mhm,
during that time. And we have a great opportunity as healthcare professionals to be bridges for everyone.
yes,
Everyone deserves great health care and great cancer care. And so COVID was particularly hard. It helped propel some things forward because we shifted some technology. We found different ways to do some things. But it was also a barrier from the way that we work, the way that we take care of people, um, the emotional toll that clinicians had during that time, and the physical exhaustion, which I think, particularly in nursing, we're kind of seeing some of those effects. Like our nurses worked so hard during
mhm,
COVID-19, nurses are not willing to go back to the status quo. Well, like we have seen, and been through the trenches, so to speak. Um, and so, yeah, COVID-19 has been a particularly
Yeah.
difficult time in my career. Um, I will always look for the learning and growth opportunity during some of those moments. Um, I got to serve alongside just the best people in the world who were leaving their families during some of the scariest moments
Yeah.
as essential healthcare workers to step into spaces that were pretty foreign to us and that were quite difficult, not just from a physical aspect, but also from an emotional aspect as
Yeah.
well. And so, again, everything comes down to people, because people in healthcare, it's why we do what we do, and it's who we get to do it with that makes the best difference, I feel.
So much happened in that time. I can imagine so much processing that you've done post COVID. If you could choose one thing that will impact you forever that came from that COVID experience, what is COVID leaving you with?
Mm. For me, it left me with always put people over policy
Mm,
or people over process.
yeah.
Um, again, many healthcare clinicians and organizations were trying to do the best we could during that time with such a novel disease and such a short timeline, that many healthcare organizations made some missteps of um, eliminating the connection
Mm,
between patients and their support system.
yeah.
And so for me, I have learned that even in moments like that, when we have this tension, where it feels dichotomous of it's either this or it's
Right.
this, we really get the opportunity to kind of step back and say, hang on just a second. How can we do both of these things? How can we take care of our clinicians and make sure that they're safe and take care of the patient and the family and make sure that they're safe? Because again, we're not only treating a medical record number, we're treating a
That's
whole
right.
person during some of the most vulnerable moments of their life. They need their connection, they need their support. We are relational individuals by nature. That is how we are designed, from a faith belief. I believe that's how
Yeah.
God designed us to be in relationship with one another. The scientific evidence and literature tells us that there's a long running longitudinal study, the Harvard Adult Development Study. It's been going on for about 50 years now. We have about 5 decades of data. And what that study, you can imagine they've looked at just about everything that you
Yeah.
can look at over the course of someone's life. But what that study has found over and over and over and validated again and again is that relationships are important. Connection is
Yes.
important, not only in the good times, but also in the times that are really crummy, the times where we're struggling, the mundane times where we're just coasting by. Our relationships and connectedness really matter. And it's one of the things that I love about CanCare is that, you really do focus on the relationship and the
Right.
connection. And whether people have a strong social support or not, everyone can benefit from an additional connection because there's something different about the lived experience,
Yes.
right? I mean, I could talk to someone about my experience with cancer as an oncology nurse, as a sister to
Yeah.
someone with cancer, as the daughter to someone with cancer. However, my sisters, my parents speak differently
That's
about
right.
cancer, right? Because they have a lived experience for that. And so the relationship is just different in some unique and beautiful ways. And I love that about CanCare, to give everyone the opportunity to have that kind of connection and relationship.
That's right. That's right. So another hat you wear is teacher,
Yes.
writer, many hats, but you have a wonderful role in shaping the future of oncology and oncology nursing through what you're doing with Duke and as an educator. Tell us about what you're trying to impart to the next generation of oncology nurses.
Yeah. So I get the opportunity at Duke to teach healthcare leaders, nurses who are executives all across really the globe. These are
It's amazing.
movers and shakers, people who have already done great things, who are going to continue to do great things. And whether it's through Duke, or I do a lot with the Oncology Nursing Society, where I love to develop oncology nurses and oncology nurse leaders. Um, Ultimately, you can distill everything that I do to it's all about people. It's all
Yeah.
about people. It's all about people. So, I focus a lot at Duke on evidence-based practice, but also technology and innovation and strategy and advanced decision making and moving healthcare forward from an executive lens. From an oncology nursing perspective, again, it's about evidence based practice and really applying the best evidence and clinician expertise and patient preference and values to really take care of people. From an administrator perspective, I want my organizations to be financially sustainable. We have to be able to be here
Yeah.
a long time to take care of people. And so, no matter what we're doing, what we're focusing on, it always comes down to people, because healthcare is nothing if not a person focused service and industry. Everything that we do is about people. We're in groups of people to take care of others. And so, yeah, you will always hear, no matter where I am, it's about people. Let's just keep people at the center of this work, and we can figure it out. We can. I know it's hard, it's
Yeah.
complex, but my goodness, we've got a lot of smart brains. We have a lot of devoted hearts and capable hands here, all in the pursuit of one thing: taking really good care of people.
It's a great grounding for all of us.
Yeah.
So, as we wrap up today, we have listeners who are currently facing cancer, caregivers, survivors, healthcare administrators, and providers. If you could choose one message of hope for our audience today, what would you want to leave them with?
Yeah. I would say you're not alone. You are
Mm,
not
yeah,
alone in whatever you are facing. And again, I know that there are people from all walks of life who might be saying or rolling their eyes right now, like, Joni, you have no idea what my life is like. Am estranged from my family, or estranged from my friends, or I don't really have a strong network, or I only have one person that's really close to me. Um, I would encourage you to expand your thought of who is there to help and support you,
yes,
because there's an entire healthcare team that's there, and maybe some are better than others. You have organizations in your community and across the globe, like CanCare, to help support you. And whether you're a patient or a caregiver or a friend or a clinician or an administrator, our relationships matter. And we all have this uniquely human experience. And it can be incredibly vulnerable to form a relationship with another person. We are better together. We are meant for
amen.
relationship. We are
Yes,
meant for community. And so you don't have to do this alone. The other thing that I would mention is that this is not the whole story. If you
Yeah.
are in a cancer, experience right now, you're personally experiencing it, or you're a caregiver, this is not the whole story. This is not your identity. This is just a part. It's
Yes.
just a sliver of the story. There's a whole other part of you, and you don't have to do this alone. There are people waiting and ready and devoting their lives to be in community and relationship with you in pursuit of care for you.
No, beautifully said, Joni. Thank you. Thank you so much for being with us today, for sharing your heart and your experience.
Oh my goodness. My distinct privilege and honor. Thank you so much for having me today.
Absolutely. And we hope you all enjoyed this episode of Hope in the Face of Cancer. We hope you will join us on our next episode. Please like and follow us. And until next time, in Hope in the Face of Cancer. Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.